Welcome to Money Matters TV. My name is James Chan of Asia Marketing and Management. Today we are going to have a wonderful program with a wonderful guest because the topic is so important as far as I'm concerned, and a lot of people are concerned. You know why? The topic is about Medicare. And you know, and almost everybody knows that every day 10,000 baby boomers are to retire. So Medicare, as far as I'm concerned, is a very, very important topic. And our guest is Mr. Tony Cucchi. He is the founding partner with his son, also Anthony Cucchi, the third. Tony here, sitting with me, will be our guest, and he is so knowledgeable about the whole business of Medicare and related insurance programs. I have great pleasure introducing Tony to you. Hi, Tony.
James.
Good to see you.
You too.
And I'm very happy that I know of you because I still have Medicare questions,
Right.
even though after several years of using Medicare.
Okay. Yeah, sure.
Now, as we chatted a little bit before we begin this the interview,
Okay.
let's be very fundamental about it. How do people, when and how do people get Medicare? When and how?
Good question. A lot of people get confused with that. So, number one, if you're already collecting Social Security, you're automatically in the Medicare program. So you will be getting a card. There's nothing you need to do. So
I have to stop you.
Sure.
For nitpicking question.
Sure.
Important. If I collect Social Security at 62, does it mean that automatically, the moment I collect at age 62, Medicare will jump in?
When you turn 65.
Oh, well, thank you.
There you go.
Thank you.
Yep.
Okay.
So if you're already in Social Security, you're already enrolled. No matter.
But not at 62, not at 63,
no.
not at 64.
No, 65,
65
is for the Medicare.
Okay,
So,
thank you. It's
right.
important.
And
Okay.
then if you're not, and you do turn 65, you actually have, it's a 7-month period.
Okay.
So you have 3 months before your birth month,
Okay.
your birth month, and then 3 months after that. So you have a good time
Oh.
to enroll.
Right.
So they,
So
they
can be
give you
forgetful a little bit.
Right.
Okay. All right.
Exactly.
So 65 key. What if people reach age 65 and they are still working, and let's say maybe their companies are providing health benefits? Am I making some sense asking
Oh,
this
absolutely.
question?
Yeah,
Then
absolutely.
what do they
That
do?
is a issue that could take place because HR departments don't necessarily inform the retirees
Okay.
of the Medicare program and how
Okay.
it works.
Okay.
So what happens is, an example is you don't want to take COBRA if they give you a retirement plan.
Yeah, a familiar name.
Yeah. It's number one, it's expensive, right? But you may not have a choice.
Okay.
It depends on your situation.
Okay.
But if you are offered a retirement plan
Okay.
from your company,
Right.
and now you are, and part of that retirement plan is off of the group plan,
Okay.
and it includes your COBRA,
Okay.
and you're 65, you still have to register for Medicare.
Okay.
Because Medicare does not deem COBRA
Right.
as
Right.
a qualified
So
source
to
of
summarize, so far 65 is the key number.
Yes.
65. Okay.
Yeah.
People reach 65, and then there is this Medicare. Explain the fundamental differences between this thing called Medigap, and then there is a supplementary plan, and then there is this plan G, and then plan C. What's going on? I'm already confused.
So you have your A and your B are your initial original Medicare.
Okay.
Okay, so A is your hospitalization.
Okay.
B is all your medical, is all your doctor, your visits. So they are separate.
Okay.
Okay. So you start with those two.
Okay.
Okay. Then you could have a choice, and that's where the confusion comes in for a lot of people because there are so many choices.
I see.
So you have a path to go down, and what we do is we consult. We have to get a really clear picture of someone's life before we can even advise them on which way to go.
Oh, so it's nothing is automatic in the sense that different individuals have different situations, and so you just have to customize according to their
Based
specific
on-
needs.
Yes.
It's not a manual driven.
No.
Anybody will know how to pick thing.
No,
Okay.
it's involved
Okay.
when it comes to the options. Automatically, you are in the A and the B.
Okay.
Okay, which is, like
Yeah,
I said,
right,
the
right,
hospital and,
right.
and the medical portion.
Mm-hmm.
And so then, if you choose to go down the original path, Medicare, in layman terms, you have an option of a Medigap or SUP program.
Okay.
Okay, and there's several options out there for that.
Mm-hmm.
Then on top of that, you could also pick an option for your prescription, which
Right.
is
Which
you know,
is kind of
be your D.
okay.
Right. Okay.
So it's slightly separate. It's another separate
yes.
I know, pile of paperwork.
Exactly. Exactly.
Yeah,
And,
okay.
and then the other route you can go is what they call is the Medicare Advantage.
Okay.
And that's your private companies, you know, all the local companies that we all know of.
Yeah.
And they have their plans, which are in like a network type. With at Medicare Advantage, that's why we take the time to really review someone's life, what's going on, like a snapshot of what's going on in their life now, you know, as much as we can in the future. You know, are they going to be working, or is their income going to stop, and they're going to be on a fixed income?
Yeah. Okay.
All these things, and especially with couples, you know,
Right.
it's you know, you got to just find out what's going on with
Sure.
the husband and the wife.
Right.
You know, a perfect example is my parents when I helped them. My father is on a Med Sup plan. My mother's on a Medicare Advantage plan. You know, and it's just the way it worked out medically wise. You know, my father had a lot of health conditions where my mother was very healthy. So we, in review, we figured, hey, these are the best plans for you.
So even you had to help your own parents.
Absolutely.
They-
That's how I really got into the Medicare
Oh.
side. I was always on the life side for years, and then
Life meaning life insurance.
life insurance.
Right.
Yes, yes, yes.
Okay.
Life
Right.
insurance. You know. So yeah, that's one of the reasons, because they were confused and they didn't. So I was all right. Well, let
I'm
me
not
educate
surprised.
myself on this.
I think a lot of people are confused. I've been receiving Medicare for some years now. I'm still confused. Although
Yes.
so far so good.
Well, yeah. I mean, the confusion comes in with the options.
Okay.
Because there's so many options. Not only do you have two paths you can go down,
Right.
but you have options within those paths.
Right.
Like prescription plans. There could be 40 different plans out there.
Yeah.
You know, Medicare Advantage, there's numerous private companies that are offering it, and they could have within one company, within one insurance carrier,
Right.
they could have 4 different plans.
Right.
So,
Maybe this is also the right moment to ask you a question from the audience, from the viewer.
Sure.
Sometimes we do get questions, not sometimes, all the times.
Okay.
We get questions from our viewers, and we kind of know that there is somebody by the name of Mark Thomas
Okay.
of Philadelphia wanting to know about Medicare. Is there an independent rating firm for Medicare insurance companies? Now, do I get it right? I think
yes,
that-
yeah.
Yeah.
In layman terms, yes.
You
that's the
answer that
perfect
question
way.
because I
Keep
know
it simple.
nothing.
Right. Well, keep it simple
Right.
so
Yeah.
your audience can understand.
yeah.
You know.
No PhD dissertation.
No,
Get
no,
the answer.
no.
Get it straight.
Answer to that question
Yeah.
is yes. There are actually some really good resources. One is called CMS, which is
Okay.
Center for Medicare Services. You can get that online. Okay, what they do, and then also there's called Medicare Interactive.
But are
Okay.
these rating firms?
Yes.
Rating.
Yes.
They rate.
CMS, like I said, they have a 5-star system that rates the carriers, and it's based on customer satisfaction.
I see.
So
You mean TripAdvisor? Sorry, TripAdvisor for
yeah.
Medicare.
Yeah, they will.
Sorry.
They will just survey
Yeah.
people that have their plans,
Okay.
and they want to know. They want their feedback, so they get customer satisfaction within 5 criterias. And what it is, it's 5 stars. 5 being the large, you know, the higher number.
So CMS is 1.
CMS is the main one that has the rating,
Right.
but you can get access to their results
Okay.
through Medicare Interactive, or also through Medicare.gov.
Right.
Okay, and what's nice about it is you can break it down by your zip code.
Right.
You know, because a lot of plans are based on your county within your area, Delaware County, Montgomery County. These carriers will have different plans in each county. So when you go up online, it's a great website. I use it as a reference because I'm licensed in 10 states.
Right.
So I will have clients call me from North Carolina, from all over.
Very good.
And so I use this.
Yep.
And what you do is you go on, you put in the zip code, and then you also list your medications. Any medications that you're on, it'll give you an analysis of, okay, what plan you're going to benefit from the most. Is your
Very
payout,
good.
is your out of
Very
pocket
good.
for the year.
Very good.
So it's a great resource.
Very good.
So that's a good question.
Thank you for that, because we need to tell our readers that here is how you can send in your questions on any shows, and we like your questions because your questions are very important to us and to our guests, just like Tony Cucchi.
You can have your questions answered on Money Matters. Please go to our website, money-matterstv.com. On our homepage, click on the banner on the right that says, Send us your questions. While you're on our website, you can find information about our host and guests, as well as show notes and links about this show and past shows. Money Matters is also available as a podcast on iTunes and Stitcher, so you can listen to Money Matters while you're on the go. That website address, again, is money, M-O-N-E-Y, -matters, M-A-T-T-E-R-S, TV.com.
Welcome to Money Matters again, and here we are, me and Tony Cucchi, who is founding partner of Mainline Medicare Advisors, with his son, Anthony Cucchi III. It's a great father and son team, family business, and I think the family business is very important. So now back to you, Tony.
Yes.
So, how about doctors? What if some doctors say, oh, I don't want your Medicare, is there such a thing? Or that I don't want the companies that you have? There is really some situation with doctors and Medicare. Am I making some sense?
Yeah.
you?
That you can get into a situation like that, not locally, if you're, because 90%, 100% have to accept the Medicare.
They have.
But if yes, they're in the program, so they have to accept, especially if it's an Advantage program or whatnot. But if you do travel. Okay, that's where you might get into some.
You mean if you go to Portugal?
Yeah, right. Now, if you're out of the country, depends on the plan you have.
Yeah, I
and,
just
and
went
you know
to
what?
Portugal, that's why.
But that's a valid
Right,
point because when we sit down with clients,
yeah.
that's like one of our biggest questions. What are your plans? Especially for a couple when they just retire. How many people? That's
and
their
they travel
dream
internationally.
to travel.
They go to China,
Exactly.
they go to France,
Yep.
they go to whatever, Zimbabwe.
Yeah, even to Canada, even
So what happens if they get sick?
Well, you have to really gear a plan that's going to help them in that regard.
There's insurance for that too?
Yeah. I mean, there's certain plans that'll be out of country, and you can get into a situation just with the Medicare. You could be on the border of, like, say, Canada or Mexico, and you will go to the closest hospital. That's how Medicare could work. That's just one caveat of, but yeah, when we sit down with clients, we want to make sure what is your lifestyle going to be, in this next year, now that you're retired.
Right. By the way, Tony, I'm a very basic person. I always ask fundamental questions.
Sure.
Because I think that the more fundamental the questions, the more one begins to learn. Yes, 65, when people reach 65, they can get Medicare, but is Medicare only available to U.S. citizens?
Yeah, you have to have been in the Social Security system. Either you've had to pay in your time. That's why when we started the first question.
Right.
So if you're automatically in Social Security, or you've turned on your Social Security benefits, you're automatically enrolled.
In other words, 40 years ago, you started working, and Social Security administration, speak English, James,
right,
started taking your money,
right,
either through your employer or if you are self-employed, directly from you, because that's my experience anyway. So you put in all your money, and sure, I understand that. But if people just came and what if they didn't work, and they never put in money into the Social Security?
Yeah, they're not even on the. They're not even recognized in the system, is what you're saying. Yeah, so you really need to be in our system and our government.
So you have to be a tax-paying citizen or legal permanent residents working and paying into the Social Security system.
Yes,
that's really what the universe.
In theory, yes, that's absolutely.
Thank you.
But once again, there is a lot of fraud in areas.
Oh, talking about fraud.
Okay.
That's big thing.
Yes, very big. Very big.
I know that there are so many scammers, we don't even know what to do
it's
now.
A shame. It's absolutely
Name one
pathetic.
or two common fraud schemes related to Medicare, or how people get infected or affected or impacted.
It's
one or
basically identity theft.
Give an example.
Here's a perfect example. And you and I spoke about this earlier.
Right,
You got a new card.
Right, I got it.
Right.
I have no idea why. I
exactly.
I didn't.
So here's what was going on. On the old cards,
Right.
they had 3 things that were causing people identity theft. Number 1, you had your signature. More importantly, you had your Social Security number on your card. Number 2, you had your signature.
Dumb and Dumber, yeah.
Yeah, right.
Yeah, really.
Dumb.
Yeah.
And number 3,
Yeah.
you had gender, so male or female. So what was happening is people were getting their bank accounts, signatures, checks being written. There's the mail, just your signatures on the card. So Social Security, Medicare had changed. Got rid of the Social Security on the card. So now you have an 11-digit number combination, letter number.
Right.
That is your identification.
Right.
So they've taken off, like I said, your gender, your signature.
So it's highly watered down.
Yes.
It's not even a piece of plastic. It's a piece of paper. With the blue
it's just
on
a piece
top.
Of paper. But it had all your previously it had all your information.
Right.
Now it just has your identification. Kind of like your driver's license, but still you have a signature.
To me, it's almost like a publicized password for the government.
Yeah.
For the government knows. The government.
Right.
That's the pet.
Here's the sad part. They went through all that expense to change it, and a scam is already out. People are getting telemarketer calling them, hunting down, pursuing predators of the elderly, and saying to them on the phone, "Oh, did you get your new card?" Yes, I did. Well, we need your Social Security number to activate it.
Oh, this is terrible.
So it's horrible. It's absolutely horrible.
I'm glad you mentioned this.
Yeah, it's great for your audience to know that. I mean, we tell everybody to just spread that word around.
Which means that Medicare will not automatically call up
never
people.
No. They will not call you to confirm that you've got your card. There's too many people, number 1, on Medicare, but they won't call you to confirm.
This is extremely important.
Very important, very important. So they're not going to sit there and tell you that you need to activate your card with your Social Security number. And so that's what's happening. These people are, willingly, yes, I just got my new card. Yeah. Oh, that's great. I didn't know what to do with it. Now I know now I can activate it. Right. And it's a big scam. It's a really big scam. The other scam that is happening too, which the government just really got down on in September, is genetic testing. There was a lot of scammers out there that were saying Medicare covers genetic testing, and it's just like a cheek swab.
Genetic testing for what?
For your genes, to see if you're susceptible to cancer, to see how your body structure can handle certain drugs. Yeah, but this is millions upon millions of dollars scam that was going on through the Medicare, and the Medicare was paying these labs, and the labs, in effect, it's a lot of money. If you were to go out and get your own genetic testing, it could range anywhere from $3,000 to $7,000.
Sounds like a big can of worms here.
Yeah, it was a shame. Yeah, they really, and we had heard about it. We were looking into it. Oh, this is a great benefit. And then I went in and I had it researched by the Medicare Patrol.
Let me go back to something more specific and useful for the viewers. Two more questions at least. The first one is, if people want to save money, it's nothing wrong with saving money.
No.
With so many options.
Yeah.
So especially, I know that there is something called AEP, or
Yes.
Open Enrollment Period. Not that I know.
It's the same thing.
I just learn it
Annual
without knowing
enrollment.
what it is.
Right. Annual enrollment period and then open enrollment.
So how do they save money during this period?
We get that question. We have to do a review because we take a look at our clients, and we'll do an annual review with our clients, especially during this period.
Also, this is not something that an individual will automatically know how to do, how to pick, how to choose.
Here's what happens. If you're in your plan and you are okay with it throughout the year, yeah, you pretty much can keep the same plan. Okay. But what happens is with the Advantage products and plans out there, they change every year. Every year they change. Now this year, they've added, all the different carriers have added so much more benefits. They have different benefits now for actual meals, if you're sick, travel back and forth to the doctor. They include a lot of different benefits, which they really hadn't before. So it's a really robust plans that they have out now. But what happens is they change every year. So you got to really stay on top of these plans. Okay. And then what happens in that effect, we need to know how you were throughout the year. Hey, how did you make out? What was your out of pocket? Because a lot of people, I want to save money, but it may not save you money just because your premium's lower.
I see.
So you might get hit on the back end with your copays your prescriptions, and you're out of pocket for that. So, in that effect, yeah, you really need to review before just thinking about saving money.
Then the other thing is, what is a Plan G as opposed to a Plan C?
The Plan G is the new plan that is replacing your Plan F. So that is a plan that has to come.
Help.
So it's just a revised, and we pretty much advise everybody, depending on their situation, but majority, you're safe to go, stay with your G.
Yeah. I don't mean to ask a sly question, but
here
is a sly question.
A sly question.
Sly. Look, what if people don't know what they're doing? They reach 65, they start collecting Social Security, and they're 65, Medicare chips in or kicks in.
Okay.
And then they don't do anything, or they don't know what to do, or don't even take any action. What would happen? In other words, they only have a chunk of Medicare
time frame to at least register.
Oh, right. So in other words, it's like a ladder with a few missing rungs, missing steps.
Okay.
So how will they know? At what point will they know? Oh, I'm missing something. I must go see someone and who can show me.
That's where.
What will trigger those questions?
Well, it's it's funny. It's not funny, but.
No,
to that question to be triggered, you really got to be alert in the fact that you need to get on the Medicare. I mean, you're in your network of friends. Your friends are all getting it.
Yeah.
You know what I'm saying? You've retired. Other people that you've retired with, they're on Medicare before you. So hopefully you've got a social network
you're
that
correct.
you're somewhat aware of what's going on.
Right.
But it's a very good question because the government will penalize you 10% a year if you don't register within the time frame.
You mean the 7 month, the 3 month here?
Yeah,
3
if you
month
don't
there.
register, for your A and B, and you are registered in the Medicare, you will be penalized 10%, and that's a year. So that happens in a scenario where someone retires, or they're still working, or they're part time, and they don't realize that they're not on the group plan. We have had an incident where people just didn't know that because they were still working. They didn't look into the Medicare. So the worst part is that penalty stays with you for life. So if you don't register and you've let it go for like 2 years, 3 years, well, that's a 30% penalty on your premium that stays with you.
Ask a very dumb question. Can people call Medicare assuming that they can get a live person on the telephone? Because I can recently.
Yeah,
but
good luck.
Assuming that they can the person working for Medicare advise people on what else to do, what more to do, other than the fact that, you have signed in?
Yeah, I mean, they really can't get into specifics of what plan they should take.
They
or,
cannot.
you know,
That
the
by
basics.
Law, that by law they cannot.
The basics they can. But to do, you know, what prescription plan they should be on, and
Right,
because
right.
there's so many prescription plans.
So there must be a lot of people like you advising
There's-
couples or
There's a good
individuals.
force of agents like ourselves.
Yeah, because then you are needed.
You need it, and it's actually underserved. I mean, that's one of the reasons I got into it, because I saw my parents. They were underserved. Their friends
Yeah.
were
and not only
underserved.
that, your parents are
So-
educated, sophisticated.
Yeah, my father was an
your
executive.
father- right.
You know, so yeah, it's we see all walks of life that need help. It does, it's not you know, it's not discriminatory.
So in other words, Tony, when your role is not a luxury. It's not a you're not consulting on a luxury.
There's a need.
Yeah, there's
a
a
big
need.
need.
The
And it's
need
great
is
to help
real.
people, especially the seniors, you know, because they need it. I mean, what's more important aside from your finances to your health,
Sure.
you know? And so, and we do the life side too, life insurance for the finances, but we see a big gap there for the health.
But also,
So-
Tony, let's be realistic here. There are a lot of people in our country who live by themselves. Even for the
Yes.
city of Philadelphia, I think a year or two ago, there was a survey that says 1/3 of our entire population,
Wow.
city population, live by themselves. So
Interesting.
if you live by
a big number.
yourself, there are a million questions
Yes.
on many things. So how do you reach out to these people and tell them that, oh, well, when it comes to Medicare, hey, talk.
Yeah.
Don't stay home.
Yeah, no,
Yeah.
it's tough to reach out to,
Right.
you know,
Yeah.
that I didn't realize that's a big number. I didn't realize it would
Oh,
be
yeah,
that big.
1/3.
And that was just in Philadelphia area.
Yeah, I pay attention to that
Yeah.
factoid.
Okay.
Yeah, 1/3 is a really big number.
Right.
Now, this
So,
is, yeah.
Like, here's an example. What some of the carriers will do during open enrollment.
Right.
We're actually going to be doing it
Right.
in Chester County.
Correct.
We're going to be at certain drugstores and
Right.
with tables
Yeah.
helping seniors.
Right.
You know, they're going
Yeah.
in, you know, and so and we have all information pamphlets, what they need
Right.
to do, our numbers, of course, for them to contact us.
Sure.
So that's an outreach program.
Right.
That
That's
the
why
carriers do.
Our program is coming to a close. They are
Okay.
going to point a gun in my head if I don't close it. That's why we can talk for a long time. But let me just say, that's why I think that our program, the topic is very timely, very important. And I have to say that we've been lucky to have Tony Cucchi with us. And our next guest is going to be Jeffrey Loria. He is Vice President of IT at iCorps Technologies. And thank you very much for watching Money Matters TV. I'm James Chan.